The Addiction Treatment Center addresses substance use disorders through a comprehensive approach, offering services from outpatient evaluation and diagnosis to advanced rehabilitation for long-term recovery and social reintegration. The center's work aligns with Kuwait New Kuwait Vision 2035, which aims to transform Kuwait into a leading regional and international hub, emphasizing social development, economic diversification, and enhanced human capital. The center contributes to these goals by addressing a significant social challenge and fostering the well-being of Kuwaiti citizens.
طبعا مركز علاج الإدمان هو مركز حكومي يتبع قوانين وزارة الصحة، فبالتالي الخدمة هذه موفرة.
The Addiction Treatment Center is a government center following the laws of the Ministry of Health. So this service is provided to all citizens and residents in Kuwait. Any person above the legal age, which is 21 years and above, is allowed to visit us at any time. Our clinics are open in the morning and we also have evening clinics until 6 p.m. So anyone who wants to avail of this service can come to us. This service is available for everyone, both men and women. For example, if a person is just following up with the clinic for a specific medical condition or addiction problem, they can come to us for follow-up without entering the hospital. Some people may say they don't want to enter the hospital. They just want to follow up with the clinic for a specific addiction issue. This opportunity is also available for individuals experiencing severe withdrawal symptoms from a certain substance they are addicted to.
نتيح له فرصة أنه ممكن يدخل للأعراض الانسحابية أيضا.
Treatment begins with medically supervised detoxification, putting emphasis on patient safety and managing withdrawal symptoms. The center staff handles various withdrawal syndromes, ensuring patients navigate this phase with minimal risk and discomfort. Medical stabilization is the foundation for subsequent therapeutic interventions and successful recovery.
طبعا مرضى الإدمان احنا دائما لما نتكلم.
Of course, when we talk about addiction, we always say that addiction is always associated with drugs. However, addiction is a behavioral disease. So when we talk about addiction, we talk comprehensively. Therefore, the services we offer are actually for this chronic behavioral disease. We have cases in our clinic that are addiction related, such as phone addiction. We have several cases, not too many, but several cases. In some behaviors, some individuals seek treatment for this addictive problem. This is also an aspect and also the services we provide, which is addiction to drugs or psychotropic substances. The service we offer is divided into medical service, psychological service, and social service. A medical service, when a person enters, he has a severe addiction problem. For example, he uses some substance or medications that lead to severe withdrawal symptoms. For example, a dose affected him severely. So we take the patient and treat him from a medical perspective, from a pharmaceutical perspective, and from a medical perspective. Then assessment begins and psychotherapy starts, as well as behavioral therapy. Furthermore, in advanced stages, we also have social therapy if there is a social problem, such as needing adjustment or something like that. After these services, the center may provide them.
فمن أهم بعد هذه الخدمات ممكن المركز يقدمها.
Following detoxification, patients enter motivation building and initial rehabilitation, involving an assessment of psychological and social circumstances that may have contributed to addiction. Patients develop insight into their condition, identify triggers, and cultivate a sense of agency in their recovery.
العلاجات اللي موجودة عندنا منين؟
The available treatments we have include medications and behavioral treatments. When it comes to medication treatments, we have the latest up-to-date options. In terms of therapeutic approaches and treatment plans, we follow international guidelines. We may adjust or regulate these plans to align with the Kuwaiti society, but the latest treatment plans and international guidelines in addiction treatments are what we use. This is if we are speaking from the pharmaceutical aspect. Even from the pharmaceutical aspect in some narcotic substances, the same substances as heroin, and heroin's issue is that when a person becomes addicted to it, they need alternative treatment. And there is a period of post-use treatment and afterward when the withdrawal symptoms disappear. This is also among the treatments available in Kuwait. This substance or medication is available and also regulated, meaning not just anyone can be given this treatment because someone might take it and misuse it. Besides, someone who takes this substance may encounter serious health issues. So we regulate the person who takes these medications by administering them through injections on a monthly basis at the center to ensure there is control over it. The quality of this treatment is based on ensuring that these treatments are not leaked or misused. Also, there are many issues regarding treatment, and many people, for example, say that we are giving a sedative or replacing their addiction with another addiction. That if someone is addicted to a substance and we give them a medication, they will become addicted, which is not true, because the patient, when entering in some sedatives or treatments, we give a limited quantity for a short period to ensure that the withdrawal symptoms disappear. Then we continue, and of course in the second plan, which is behavioral therapies, is also one of the advanced treatments we have.
العلاجات السلوكية أيضاً من العلاجات المتقدمة عندنا.
Therapeutic approaches include cognitive behavioral therapy, CBT, motivational interviewing, and group therapy. The center's multidisciplinary team develops individualized treatment plans addressing the root causes of addiction to promote lasting change.
طبعاً المريض لما يدخل احنا قلنا علاج الإدمان وايد.
When the patient enters, we said addiction treatment and a lot of addicted patients, but let's talk about drug addiction patients. When the patient enters with us, they go through 3 basic stages. The first stage is the detox stage, where the patient stays for days to a week in one of the wards for detoxification. In this stage, the treatment is purely medical, with the patient being monitored around the clock for 24 hours. The patient then is medically evaluated to see if he needs mental care. For example, in the accident departments, is there a possibility of a health problem? Is all this treated during the period? Also, the patient is treated with medication to ensure that withdrawal symptoms, when they occur, pass slightly without being severe enough to cause death. For example, we often tell patients who drink alcohol that alcohol withdrawal symptoms can be severe and can lead to death, and the patient can enter the intensive care unit because of this. So we ensure that there is no severe deterioration at this stage, which is the first stage. The second stage, which is the rehabilitation stage, or the initial rehabilitation, after the patient finishes the withdrawal symptoms that last from days to a week. Then they move to the initial rehabilitation stage. During this period, there is a psychiatrist and a psychotherapist to evaluate the patient's reasons for substance abuse. The patient's compliance is to complete the treatment program. Are there psychological reasons and issues that lead to substance abuse? Are there social problems? Because when a patient is with us, we try to take into account the patient's overall situation. It is possible that they have social issues that led to substance abuse, so we resort to social services to help us. Maybe there is a psychological problem, so the psychiatrist is there. And if there is a behavioral issue, then the specialist evaluates the patient as a whole. After evaluating the patient is given the choice of what treatment stages to follow next, either to go for continuous care, where they visit daily for examinations, lectures, and the consultation with the doctor, and to return to their home or work, or we have clinics once a week or twice a week, or we have a residence along the way which represents the advanced stage, where the patient stays for approximately 6 months to a year with an open arm, and the patient is treated behaviorally.
ويتم فيه علاج المريض سلوكيا.
A cornerstone of the center's approach is continuous care, an outpatient service model that offers ongoing therapeutic support enabling individuals to maintain their daily routines. This model recognizes that recovery is not linear and that sustained support is beneficial.
طبعاً مركز علاج الإدمان.
The message that addiction treatment centers provide to society is that treating this disease is a chronic condition. We understand that some people have the idea that addiction can be cured and that's it, while others do not recover from it. However, it is a chronic disease. For example, if we see a person who has diabetes for a whole year, the number of relapses they experience during that year will vary. During the year, the number of exacerbations experienced by asthma patients and the percentage of relapses experienced by addiction patients. Between these two groups is what we deal with. We are the ones who build, expand, and provide to the community that this is a chronic disease with possible relapses. However, with an open mind, the center provides therapeutic services, trying to help the individual avoid further relapses. This is what we do, attempting to make the individual a productive member of society. The idea of treatment is not just to confine the patient and keep them, but to treat the patient so that they become a productive member of society and can face social challenges.
تحديات المجتمعية.
The center empowers individuals to take ownership of their recovery with flexible and accessible outpatient services, including individual counseling, group therapy, family therapy, and support groups. Service frequency and intensity are adjusted to meet changing needs. The center also uses telehealth for remote counseling and support.
مثل ما قلنا في بادئ الأمر أن المركز هذا هو مركز حكومي تحت وزارة الصحة.
As we mentioned at the outset, the center is a governmental center under the Ministry of Health. So it adheres to the laws of the Ministry of Health and the laws of the state regarding the patient's rights. This means that when a patient enters, their file is kept completely confidential, and no one is allowed to access or alter the patient's file without authorization, even if it is a close relative like a parent, spouse, or child. Official authorization documented by the Ministry of Health. We do not provide any patient data, as the patient's data is kept confidential and cannot be accessed except by the patient or by an authorized entity such as a court, prosecutor's office, or like that. This is also a matter of patient privacy. So when you visit us today, we try to record the place in a way that is not disclosed. Patients, for example, we either photograph them from the side or go out with them or something to preserve the patient's privacy. We are in a conservative society. We know the nature of this disease and its impact on society. To protect the individual, we must preserve the privacy of this patient and also maintain the confidentiality of their information.
لهذا الشخص لهذا المريض أن نحفظ خصوصيته ونحفظ أيضا سرية معلوماته.
For individuals needing more intensive intervention, the center offers advanced rehabilitation in a structured halfway house environment. This residential program provides a comprehensive therapeutic experience with a staged progression towards social reintegration. Residents participate in various therapies, skill development workshops, and educational sessions. The program emphasizes monitoring assessments and life skills development.
المركز هو بالسابق كان يتبع إدارته.
The center previously used to fall under its administration along with the psychiatric medicine administration, but was then separated. If I'm not mistaken, this happened in 2015. During this period, a trend emerged that the person who has an addiction is treated here, while the person with a psychiatric illness is treated there. However, there are individuals who suffer from both. We call it a dual diagnosis. A person who suffers from a mental illness, such as schizophrenia or others, and also suffers from addiction problems. So we have it here. A comprehensive wing treats this category of diseases. People suffering from mental illness and also an addiction, God willing, the future plan is also to have a dedicated wing for them for rehabilitation treatments, whether occupational rehabilitation or behavioral therapies, in order to qualify these individuals. Because the primary and best idea of treatment, as we said, is to make them active members of society. I detained him so So this person suffering from a mental illness must also become an active member in society.
عضو فعال بالمجتمع.
The halfway house program addresses factors that contribute to addiction and hinder recovery, including housing instability, dysfunctional relationships, legal difficulties, and financial hardship. By providing support and resources, the center creates a stable environment for individuals to focus on recovery and develop tools for a fulfilling life. This includes assistance with housing, family therapy, legal aid, and vocational training. The program also puts importance on essential life skills, such as budgeting, time management, and problem solving. To help individuals function independently, this advanced therapy aims to equip patients for successful re-entry into society.
مركز علاج الإدمان يقدم الخدمات كاملة لمن يتم تشخيصه باضطراب استخدام المواد النفسية، وهذا هو المصطلح العلمي اللي ما نسميه نحن الإدمان، وهذا ما جرى عليه.
The Addiction Treatment Center provides comprehensive services for those diagnosed with approaching substance abuse, which is the scientific term for what we call addiction. This is what the language refers to. We take care of treating the addict starting from the evaluation process in the outpatient clinic and diagnosing them with this approach. We enter the first stage, which is the detoxification stage, then the motivation building stage, which is the initial rehabilitation. After that, there will be a follow-up treatments, one of which is carried out through continuous care, where the individual who has gone through this experience will almost daily come to us for therapeutic and psychological services. And there is another path that we always recommend, which represents a point of pride for therapeutic services in this field in Kuwait and at the regional level in general, which is the advanced rehabilitation therapy process, including halfway house support. The halfway house provides full accommodation services for these patients, approximately 4 to 8 months during which comprehensive care is provided through various stages, meaning that for each stage completed by the patient, more space is given for integration into the community outside. And all of this is done through the system. Precise monitoring and follow-up, conducting analysis, providing necessary skills to be accomplished over a specific time period, and adjusting the conditions that lead to addiction deterioration, including residential status, relationship with surroundings, legal status, and financial situation. All these objectives are achieved in this advanced therapy stage, so that the patient is ready to re-engage in society and has overcome many of the destructive effects of addiction.
القانوني وضع المادي، فكل هذه الأهداف يتم تحقيقها في هذه المرحلة العلاجية المتقدمة.
A fundamental element of rehabilitation, aligning with New Kuwait Vision 2035, is restoring the individual's capacity to participate in everyday life. This normalization process involves rebuilding the ability to fulfill responsibilities, engage in social interactions, pursue healthy habits, and cultivate a balanced lifestyle. Addiction often leads to withdrawal from these essential aspects of life.
ونقطة وايد مهمة في عملية التأهيل هي أنا أسميها عملية تطبيع للفرد مع.
A very important point in the rehabilitation process is what I call the normalization process for the individual. What we do by the normalization process, whenever someone enters the world of addiction, it's like they are leaving us, leaving these nice responsibilities, these beautiful things, this pleasant sitting you see in restaurants and coffee shops, in normal social interactions, in exercising, enjoying the atmosphere. We are an important part of our treatment to restore this healthy relationship to the individual with these activities, because it is one of the signs of mental health, as mental and psychological health does not mean absence of illness, because it means the ability of a person to enjoy his day and his life and contribute to his community and progress in life, and accept its challenges and overcome them. And thus, sports and recreational activities represent a significant part of the rehabilitation process. Because when you teach the patient that he enjoys entering a challenge, it means the consequences are commendable. I start exercising today, and I swear I'll remove this excess weight early. I will carry more today. For example, I run half a kilometer. Tomorrow, I can increase it. And such things contribute to psychological stability and its ability to enjoy life, which means disturbance, or dealing with the interference that results from the insistence on the idea of returning to deal with it. So we are very interested in sports activities and providing facilities, and thank God the government of Kuwait, through these institutions that belong to it, has spared no effort in providing all the necessities.
في توفير كل المستلزمات هذه.
Recognizing the interconnectedness of physical and mental well-being, the center integrates sports and recreational activities as a therapeutic tool. Physical activity promotes psychological stability, enhances self-esteem, and reduces stress and anxiety, and fosters a renewed ability to find joy in life. Exercise releases endorphins and can improve sleep, energy levels, and reduce cravings. The center provides fitness facilities and recreational programs such as team sports, yoga, meditation, and art therapy.
عقب ما يتخرج المريض وما تنتهي علاقتنا فيه، في عندنا احنا شيء نسميه.
After the patient graduates, our relationship with them does not end, as we have something called a halfway house friendship, where the graduate themselves offer support, advice, and encouragement to individuals present. As they are an example who has benefited from the services provided, they extend their help. In essence, this support period varies, let's say from 5 to 6 months at minimum, and approximately extends to 1 year depending on the patient's condition and life requirements.
إلى سنة حسب حالة المريض ومتطلبات الحياتية.
The center's commitment extends beyond the formal treatment period. A peer support system connects graduates with current patients, offering guidance and encouragement. This network provides hope and inspiration, demonstrating that recovery is possible. Post-treatment support is tailored to individual needs, acknowledging that recovery is a unique and ongoing journey. Graduates may serve as mentors, sharing experiences and offering support. The center recognizes the challenges of transitioning from treatment to independent living, and that ongoing support is essential for preventing relapse and promoting continued growth. By fostering this supportive community, the center aims to maximize the chances of long-term success and successful reintegration.
طبعا يعني أنا أشكر جدا وزير الصحة دكتور أحمد.
I thank very much the Minister of Health, Dr. Ahmed Al-Awadhi, for his continuous support for this issue from a health perspective, and of course all participating government entities have shown their interest in this issue. Therefore, the current center, thank God, is no longer the old building, as we have expanded to new premises. The number of addicts has reached over 500 addicts, which is considered an achievement. This means that the figure we have in Kuwait in terms of addicts seeking treatment for addiction exceed those in European countries. This is a very large number. Additionally, government entities are providing continuous cooperation with us in terms of patients who want to work while receiving treatment. The matter is also open and allowed, with the condition that it is inspected, as this also reduces the social burden on this thing, and they are trying to show people that reducing the stigma that a person suffering from addiction can be employed, as they are state agencies participating in this thing.
يقدر إنه يتوظف، فهم جهات الدولة مشاركة بهالشيء.
New Kuwait Vision 2035 is a development plan to transform Kuwait into a leading regional and international hub. The vision includes economic diversification, infrastructure development, enhanced healthcare, and the cultivation of a skilled and creative human capital. The plan seeks to reduce reliance on oil revenues, promote sustainable economic growth, and improve quality of life. The Cooperative Rehabilitation Center for Addiction advances these goals, especially in healthcare and human capital development, by addressing a critical social issue.